today we're going to be talking about what to expect on the day of your procedure. So what to expect during your labiaplasty procedure. Hi everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two female board certified plastic surgeons.
Yeah.
I'm Dr. Smita, board certified plastic surgeon down in New Jersey, and I've got my dear friend with me, Dr. Amalfi, my co-host up in Rochester. Hi Ash.
Hi girlie.
All right, so another amazing series we're doing on labiaplasty, and today we're going to be talking about what to expect on the day of your procedure. So what to expect during your labiaplasty procedure. And I think this is sort of the easy part, right, Ash? This is sort of like of the whole process. This is the 100%. Easy part.
But you guys are like the most scared about this. Like everyone is sitting home freaking out about the day of their labiaplasty. That is the easiest part. And I try to tell people that so that they like relax, but still they don't, and they're still nervous.
No.
But
which is normal. I mean,
everyone's always like, "Oh my gosh, this was so much easier than I expected." So the day of is really not hard. The recovery's hard, but the day of the procedure, we're going to kind of walk you through all of it. But, people are really nervous, which is kind of like a great way to start. Because if you are nervous, ask your doctor, because sometimes there's pre-medications that we can give you that just help you, like, chill. And someone needs to drive you if you're going to be taking those kind of sedating meds. But there are meds that help with anxiety that you can take the night before, or some meds that just help you relax on the day of. And even in an office-based procedure room, as long as we're giving you some of those safer oral medicines, that's definitely something we can add in so that you feel comfortable. So
yes, absolutely.
Just ask, right? Like if that's something.
Yeah, that's the thing. Help. Always just ask. Yeah.
Absolutely. And then what happens when they get there?
Yeah, I mean, so I think there's a lot, right? So I think before you even come and see us or you're placed in the room, you'll meet with the nurses or the MA or sign paperwork, do all that stuff. I always tell people to bring, and I know you do this too, bring headphones or something just to zone out, because it's going to seem like an eternity for you when in reality it's actually pretty quick. But it's sort of nice to just relax, listen to some music, even if you have an iPad or your iPhone, to just sort of watch something and zone out.
Yep, stay distracted.
It distracts you from everything. But depending on the practice that you go to, you might have some numbing cream applied or be given ice packs to really sort of numb that area, essentially, so that when we sort of start the procedure, you're nice and comfortable.
Yeah, I mean, and when we do those things, when we put that cream on or when we ice the area beforehand, just like when we're doing injections in your face, it actually makes it so much more comfortable, so that when we're actually injecting the pain medicine, the numbing medicine, you may or may not even feel that part. Like, I think people are always really nervous about it because it's such a sensitive area, but it does really well. And you might feel a little pinching, a little burning, but honestly very little. And that's it. Like, that's actually the only part you feel. Once that stuff is in, that you're done. Like, you're just sitting there in an uncomfortable position, like at the OBGYN office, you're just sitting there in the stirrups, but you don't feel anything, which is wild.
Right, exactly. I mean, it's literally seconds where you might feel that little pinch or the little burning, but the good thing about that area is it numbs up so quickly.
Yes.
And then you're just hanging out, right? And I think that's it's just, we've all been to the OBGYN. We've always, we've all had our like annual GYN exams, and it's just like that. You're just
sitting there. Yeah.
Sitting there, except you don't have to talk to your OBGYN. You don't have to talk to us. You can just zone out and listen to music or whatever
you want to do. Yeah, if you want to put your headphones on
or you can chat with us.
World.
That's fine too.
Yeah, I like to talk to people. I think people are so interesting, and so sometimes we have really fun conversations talking about like what they're gonna stream on TV or listening to music together or whatever. 'Cause you're way more chill and relaxed than you think, especially by that part, because there's nothing that's gonna hurt. You're comfortable, you're relaxed, and so you can kind of hang out with us or zone out. Either is fine. And really during the procedure, for us, it's just a ton of sewing. So you're just sitting there waiting for us to be done sewing, and and honestly, that's it. That's like really the whole thing. And then the girls,
it's just a lot of sewing, right?
Get dressed and put pads in your underwear and put some cream on there just so you're ready to go home. But honestly, you guys, the procedure itself, what to expect, it is so straightforward. It is so easy. It is not scary. We are not scary.
No.
And then it's done. And then it's done, and you just get to go home and relax and take care of yourself and recover, and you can stop worrying about it.
Exactly. Yeah. I mean, there's I like what you said in the beginning, right? This is what everyone is the most nervous and anxious about, and this is the least.
Easy.
And you'll quickly find out once you get started. I think there's like that moment where everyone just all of a sudden relaxes, right? Cool. And then it's a piece of cake. So so I hope this was helpful for all of you guys thinking about a labiaplasty or have one scheduled, one coming up.
Don't be nervous.
Don't be nervous. Don't be nervous. It is going to be a seamless experience for you guys.
It's going to be worth it. We promise. So we look forward to seeing you guys for your labiaplasty. Check out all the rest of these episodes in our labiaplasty series. We've answered so many questions. We know you guys are so curious, and we are happy to bring you real information from two board-certified female plastic surgeons. So make sure you're subscribed on Spotify and YouTube and catch all the latest and greatest from all our series.
We'll see you guys next week.
Bye, Ash. Take care, guys. Bye, Smith.
Bye.